Good afternoon. You know, this is a lot easier with a bunch of Boy Scouts. I'm telling you, you just raise the little scout sign and all the kids get quiet. But with preachers that don't get around much, it's a little harder, but welcome. It is good to see you all. My name is Jason Mackey, Benefits Administrator for the conference. You all are here to talk about health insurance. Okay. It'll be a good conversation this afternoon. We have a lot of good changes, necessary changes coming to our plans. You know, health insurance is a scary topic, but we want you to not be scared today. And so we have an expert, Bob Gerlach from Wespath has come out. He flew into Baltimore last night, 2.5 hours late. So we are grateful that he is here this morning. He's leading our session today, and he's leading also another session tomorrow in Bloomsburg. So if you didn't get enough today and you want to see Bob again, come back tomorrow in Bloomsburg. Wesley, we'll see you there. Everybody got a handout when you came in, hopefully. This is the 2024 plan comparison chart. On the inside of that handout was the rate sheet. Bob's going to address both of these with you. So stick with him. If you need restrooms today, housekeeping items, you're going to go out the door, go left. If you go right, you're going to get trapped, and we'll listen for the screams. So go left and go around the coffee bar. The restrooms are on the other side of the coffee bar. And then as you come back, if you'd like some water or coffee, help yourself. So I think that's everything for now. Okay. Bob, I'm going to turn it over. Thank you. Gotcha.
Coffee? Need your coffee?
Oh, I do need my coffee. Thank you.
Good afternoon, everyone. We are going to spend some time talking about health benefits for 2024. Please feel free to stop me at any point if you have questions. Perfectly fine. I will get back on track because I'll just look at my slides and remember where I need to be. I'm going to talk about the plan options, medical, dental, and vision. When I say medical, that always includes pharmacy and behavioral health. So if I don't say those two components, that doesn't mean they're not included. It just means I'm, trying to shorten it a little bit. I'll talk about the plan changes we have coming from 2024. We'll go over the premium credit, health accounts, the decision support that's available as we look to AE, which starts November 1st, so that you can make an informed decision when you choose your plan. Talk about how you'll make those elections, and then I'll answer questions at the end, but also throughout. I've even got a couple stopping points for questions just to make sure I'm not rattling things off too fast. We always start with this. I don't particularly like reading it to everyone. I probably should have brought it as a handout. These are just kind of the standard insurance terms and acronyms. They are on the front page of the booklet in front of you. I think they're right on the front lower right-hand corner. Is that right? So if I say something that you don't understand, feel free to take a glance there or just stop me and ask me to explain what it is. That's fine. So when we look at HealthFlex, HealthFlex has a goal of providing high-quality partners. This is probably the first of many times you'll see this name, not many times today, but many times going forward, of Quantum Health. They are our new partner for care coordination, and I'll talk about that a little bit today. We have OptumRx for pharmacy, VSP for vision, Cigna for dental, MD Live for telemedicine, and then Health Equity handles those health accounts. And then we have broad network access. So across all of HealthFlex beginning in 2024, same as you have today, we're going to use the Blue Cross Blue Shield PPO network. It is their widest network. That means if someone is in any of Blue Cross's local networks, they are in HealthFlex. And then all plans use the same OptumRx formulary. That means if a drug is covered, it's covered across all plans. The difference would be how those plans would pay for that prescription. We do have multiple options, right? And this is where we take something that's confusing and it gets more confusing, right? We have 6 combined medical, pharmacy, and behavioral health plans, up to 3 dental plans, and 3 vision plans. The reason we have so many is because healthcare is not really one size fits all. Although later on I'll tell you how it's one size fits most when we look at HealthFlex plans. So you can choose what plan you want based upon really what your expenses are going to be, what you anticipate them being, who's going to be covered, and how prepared you are to take on financial risk. And then because we have so many choices available, we do have a lot of individual support. We've got Alex Benefits Counselor that is live now. We've got the prescription drug pricing tool that will be available soon, the plan comparison that's in front of you, that booklet that I'll walk through, and then other detailed plan materials that are available online. Within HealthFlex, every single plan has the same award-winning well-being programs. For each covered participant and covered spouse, you can earn up to $410 each over the course of a year. It is very easy to get the $410. I do pretty much nothing extra except get my blueprint for wellness, read some articles online, and track my activity in my Virgin Pulse app, and I get my $410 every year. And then beginning next year, we're introducing care coordinators. So this is something that we've actually been looking at doing in HealthFlex for about a decade. Care coordinators are there to kind of remove you as the middleman or middle person between the plan and your doctor. A lot of times when something comes up, the doctor says, oh, you need to talk to your plan for why it was billed that way. Or you go to get a prescription filled and you find out it's not covered. And then you've got to go back to your doctor to ask for a different prescription, or you have to call OptumRx to find out why it wasn't covered. Quantum Health is the company we're using, and their care coordinators are going to be that team of nurses, benefit experts, and claim specialists to help support you. So after you make your elections in November, new ID cards are going to be sent out to everyone. You'll get them between Christmas and New Year's, and there will be one number on the back to call, and that's for medical, pharmacy, and behavioral health total. You do not contact Blue Cross Blue Shield for anything, and only for eligibility issues or questions would you be likely to contact Wespath's active benefits team. That's the team that took over health when customer service had their reorg earlier this year. Now, that doesn't mean don't ever call Wespath. That is not what we're trying to do here. What we're trying to do is get you connected with an expert that's going to help you with the issue that you have. Today, when you contact what was the health team at Wespath, they would reach out to Blue Cross and handle some of that back and forth, or through OptumRx. The care coordinators are essentially the plan for us, meaning they are the last stop to authorize to the provider if they will get paid. So that means the provider is willing to talk to them because they hold the purse strings, right? So they do all that back and forth. In many instances, you will not even know that conversations took place between the plan and between the doctor, between the plan and between the pharmacy. So they're going to offer that support from diagnosis through treatment. If there's medical necessity needed, they are going to be the ones to reach out and get that. Again, taking that pressure off of you. And most importantly, they're going to work between the provider and plan. I've been in benefits for over 20 years, and I have had situations that have come up where I know exactly what needs to be done, and it takes me hours to get the right result, right? And I speak their language. I know how to ask. I know what they should be doing. And it still takes me a long time to do it. So for someone who is not as familiar with the system, we know it's frustrating, and that's why we're introducing care coordinators. The most important part, they intervene before the challenges occur. So you need a prescription drug that maybe is not on the formulary or maybe needs a prior authorization. They are handling that with the provider in many cases before you even go to the pharmacy to pick up your prescription. So it's going to really streamline things. If you get a billing, if you get something in the mail and you're not sure why you were billed for this, you're going to call Quantum Health. You're going to call the care coordinator, and they are going to do all the research and handle that for you. Before I dig into the plans, care coordination is starting in January. So January 2nd, 2024 is the first business day of the year. That's when those lines will be live for you. Because of AE happening in November and care coordination in January, we've kind of held off on pushing out a lot of care coordination information, but we will be doing so starting in the later part of December and certainly into January. In 2024, we will still have 6 combined medical, pharmacy, and behavioral health plans. The C2000, C3000, and B1000 are staying the same. All the HSA plans are changing, and I'll explain why in a moment. We have the same dental plans, same vision plans, and same health and reimbursement accounts. Those are not changing. Today, we have 3 plans with an HSA, and we'll have 3 next year. Today, we have the H1500, the H2000, and the H3000. Every year, the IRS sets a minimum deductible that a plan has to meet in order to be paired with the health saves account. In 2023, that deductible is $1,500 for an individual and $3,000 for a family, which is exactly the deductible that we have on the H1500 that we've had for years. So finally, the IRS has raised that to the point that if we did not make a change in the H1500, the plan would be non-compliant next year. And we don't want to offer a plan that is meant to be paired with an HSA without the ability to pair it with an HSA. So we knew we had to change that plan. And we also knew that we wanted to continue to have a gold, silver, and bronze offering. So when we changed the H1500, it now became an H2000. The reason for that is because we did not, a couple of reasons. First of all, we did not want to just bump it up a little bit and then have to keep changing that plan every single year. When we looked historically at where the deductibles were, we feel like this gives us at least 3 years where we should not have to go back and change the plan. Now, the IRS is going to do what the IRS does, so we have no control over that. It might be that we have to reevaluate that sooner, but we at least know that we're going to get 2 and hopefully 3 years out of the H2000 plan. Now, since we landed on H2000, we couldn't have another H2000 plan, a silver plan. Is this flickering or no? I'm not sure what, I don't know what's going on with my laptop and why it's making those noises, and I apologize. So we landed on the H2500 plan. And then for our bronze offering, we have the H5000, which is a very new type of plan that I'll explain in some more detail in a moment. When we look at the differences, I'm going to go kind of section by section here. The H1500 to the H2000, we of course had to increase the deductible to make sure it was IRS compliant. So now the deductible goes from $1,500 to an individual to $2,000, and then $3,000 to $4,000, right? So the number in the plan name is the individual deductible. You double it, and that's the family deductible. We kept the coinsurance and out-of-pocket max the same. And to take a little bit of the sting away from that increased deductible, we increased the HSA contribution. So it goes from $750 or $1,500 to $1,000 or $2,000. And by doing all those things, it is still a gold level plan. It also very closely matches the C2000 design, which is one of the HRA plans. So the gold HRA plan. For the old H2000 to the H2500, we of course had to increase the deductible. Coinsurance and out-of-pocket max stay the same. But to be sure that that plan remained silver, we didn't want to have 2 different gold offerings. We actually had to reduce the contribution built into the plan. And we want to have gold, silver, and bronze for a couple reasons. The first is that we want some difference and some spread between those plans as far as how they work, but it's also a way to make sure we have appreciable difference in the premiums so that people would want to choose one over the other. So that funding contribution matches the C3000. The deductibles and coinsurance aren't the same there, but we're trying to make sure that the differences between the plans are more easily understandable. And you'll see that more when I talk about the H3000 to the H5000 now. The H3000 today has a $3,000 individual deductible, $6,000 family. For all the plans we have today, as well as the new H2000 and new H2500, if more than one person is covered, you have to meet the full family deductible. So I like using the example of my family. Myself, my wife, and my daughter are on our plan. We're in the H3000. That means because more than one person is covered, we have to meet a $6,000 deductible each year before the plan starts paying. And then the out-of-pocket max is $6,000 for an individual or $12,000 for a family. Out-of-pocket max always applies at the individual and then caps the total cost. In the H5000, we have a $5,000 individual deductible and a $10,000 family deductible. But as you see, there's no co-insurance because once you meet that deductible, you've also met your out-of-pocket max. So this is a deductible-only plan design. It's actually something that we've had plan sponsors asking about for the past few years. And when we looked at changing these plans and what the spread would be, we saw an opportunity to do two things. One, to give some of our participants and plan sponsors what they wanted in a deductible-only plan design. And by doing so, we're able to reduce that out-of-pocket max lower than what the H3000 has today. And that means we have the same out-of-pocket max across all plans, making it much easier to compare what your total cost would be, right? You don't have to say, oh, well, here's the difference in premium, but I've got to pay more in out-of-pocket max if I have a really, really expensive year. Now you don't have to worry about that, right? If you know you're going to hit your out-of-pocket max, the vast majority of people should be in the lowest cost plan, right? If I'm going to have $5,000 in expenses, I should pay the least amount per month. That's where my savings will be, right? We have 3 HSA plans today, and we will have 3 plans next year. If you are in one of the HSA plans today, or even if you're not, I encourage you to go out and make an active benefit choice for next year. But if you're in one of the HSA plans today and you do not make a choice, we didn't want to just drop your coverage completely. So we are going to move you automatically into the plan most similar to what you have today. So that's gold to gold, silver to silver, bronze to bronze. If you are in an HSA plan today, last week you should have received an email invite to one of the targeted webinars that we have on October 23rd. So we're going to have 3 different webinars, one for people currently in the H1500, one for people currently in the H2000, one for people currently in the H3000, to explain the differences between those plans and to give you an opportunity to ask any questions. We are going to record those webinars, and we will, as a follow-up, send the recording out or a link to the recording out to anyone who is currently in one of those plans. So even if you can't join and you don't sign up, we're still going to get you a copy of the recording to view if you want. And those will be an hour each. They're probably going to be closer to 45 minutes because they're back to back. So now that we went over the changes, I'm actually going to take it back a little bit and talk about how all the plans work, right? Because all the plans essentially work the same. Each plan has a deductible that you must meet before the plan pays for its portion, right? And then once you meet the deductible, there's co-insurance where you pay a portion and the plan pays a portion. You can use your health account, whether it's money that you've put into an FSA or HSA, or it's money that's built into an HSA or HRA, you can use that money to meet your deductible. And then once you hit the out-of-pocket max, which is now the same for all plans, then you don't pay anything more through the end of the year for any covered services. Co-payments are a little tricky. Now the B1000 is the plan that has the most co-payments, right? There's a co-payment for doctor's office, specialist, behavioral health visit, urgent care, and ER. Those do not count towards the deductible, but they apply immediately. Some of the pharmacy co-pays also apply immediately and do not count towards the deductible. The reason that co-pays don't count towards the deductible is because you're essentially bypassing the deductible phase where you would pay everything, right? You would pay all the reduced costs. So that's kind of the rationale. And while they don't count towards the deductible, they do go towards your out-of-pocket max. That is not something that happens in all plans, but HealthFlex, we have a true out-of-pocket max. The regulations say that you do not have to stop charging copays when someone hits their out-of-pocket max, but we think that's confusing and doesn't really make a lot of sense. We don't think it's logical. So when you meet your out-of-pocket max, you do not pay copays. And when we look at all of this here, especially the 5,000, 10,000 out-of-pocket max, it is for medical, pharmacy, and behavioral health. It does not apply to dental and vision. I'm going to go through these next couple pretty quickly. Every single plan allows you to see the doctor you want without a referral as long as they're in network, as long as they're in that Blue Cross Blue Shield PPO. All medications on the formulary are covered regardless of which plan you choose. They're all going to have care coordinators next year. Same coverage for medical services and prescriptions, same well-being programs. And then this is something that you may have seen come out earlier this year. We got a little bit of relief in the regs that we're allowed to offer zero-cost MD Live for medical and behavioral health, even if you're in an HSA plan. So before that regulation came out, you would have had to pay for those MD Live telemedicine services. Now we can offer them for free. The regs state that it'll be at least through the end of next year. As long as they keep allowing us to do it, we do not want there to be a barrier to care. We are going to continue to offer it for free as long as the regulations say we can. There are some differences. I mentioned those copays on the B1000 for doctor urgent care and ER visits. We don't have copays for those in HSA and HRA plans. They are meet the deductible and then coinsurance applies. For pharmacy, unless it's a maintenance medication, HSA plans require that you pay for that until you meet your deductible. In the HRA plans and B1000, we have copays and mins and maxes that apply. Behavioral health office visits are different across the board. Unfortunately, regulations do not allow us to consider those preventive for HSA plans yet. It is something that bothers me to no end because we would love to be able to pay for that through the plan without you meeting the deductible. Regulations say that we can't. On the HRA plans, the regulations don't get in the way there. So we have removed that barrier on HRA plans, and we did that several years ago. And then we have the fixed copayment on the B1000 plans. Additionally, for behavioral health plans, those networks are notoriously narrow, and finding a behavioral health provider is extremely difficult to do because those networks are narrow. So within HealthFlex, you pay the same you would pay whether they're in network or out of network, and the plan makes up the difference. We want people to be able to use the providers they want on behavioral health, and without enough of them available, we've said we're just going to treat all providers as if they're in network. So if you go to a provider in network and you pay $50, if that provider leaves the network, you would still pay $50 to see them. We will make up the difference in the plan. And then health accounts, the B1000 only in FSA. The HRA plans have that money built into the HRA. You would make personal contributions through an FSA. And then the HSA plans, you really want to take advantage of the HSA if you're able to make contributions there. For the vast majority of people, unless you're contributing the max to your HSA, you shouldn't even consider contributing to the FSA because the HSA rolls over in perpetuity, and the FSA, you could lose a certain amount if you don't spend it by the end of the year. So max out your HSA if that's something that you're able to do. And then if you have some additional like dental and vision expenses that you know you're going to have, then put those in an FSA. We actually have a one-pager online that you can see talking about some HSA, FSA considerations and when you would want to contribute to both. So now the plan comparison that's in front of you, I'm not going to go through this in great detail and read it to you because I don't think you need me to read it to you. If you open up to the middle though, right across the middle, I believe that is where you will see on that middle fold, depending on how it printed. Usually the middle fold prints all the plans across side by side where you could see the medical pharmacy, or I'm sorry, the B1000 and HSA and HRA plans all together. That's where you're going to be able to see the comparison of those plans. Thank you very much. So what you're looking at is actually it's page 4 and 5. It's not the middle anymore. We used to have it in the middle. Page 4 and 5. This is where you're going to get a lot of the comparison side by side of the plans, so you can see how they're the same and how they're different. We've got a ton of detail in here, and then pharmacy comparison on page 7. For the vast majority of people, when you're looking to choose between plans, this covers all the high level things. If you need to see the benefit booklet because you really want to know if a piece of durable medical equipment is covered by the plan, we have that online. I would say beginning in January, that's something you're going to want to reach out to the care coordinators for and not try to dig through an 80-page benefit booklet. That's another service they can provide for you. So when you're looking to compare plans, there's some things I want you to remember. First and foremost, just because a plan costs more doesn't make it better. I gave the example earlier that if you're going to hit your out-of-pocket max, you should choose the least expensive plan, right? And let's look at this rate sheet for a second. We'll go into it in a little more detail, but just while I'm talking about this here. So let's look at the B1000 for family coverage compared to the H5000 for family coverage. The B1000 costs $785 a month. That is what it costs for you after the conference has put in the premium credit. The H5000 costs you $40 a month for family coverage. So $745 a month over 12 months is somewhere north of $10,000, I think. It's definitely north of $9,000. If you're going to hit your out-of-pocket max, why would you pay $9,000 more in premium to pay $5,000 out of pocket no matter what? So you really want to look at what the premium is on these plans. For the vast majority of people, the most money you will spend in healthcare every year is on your premiums. Now, if you're in because of the generous premium credit, if you're in a plan that only costs $40 a month, then no, you're not going to be spending the vast majority of your healthcare purchases on premium. But it also gives you an opportunity to save a bunch of money in an HSA. Same quality, same services on all plans. We've done some analysis and found that over 90% of people would save money in an HSA plan. I'm going to talk about that more a little later. So if everyone wants to save money in 2024, everyone probably needs to find ways to save money nowadays. So always consider the premium cost. When you're looking at what you're going to pay for medical next year, medical, pharmacy, behavioral health, you want to look at the premium and what your services are going to cost. And Alex is going to help do both of those things. You could look at your explanation of benefits to get an idea if you don't trust what Alex is saying, and I'll tell you, 67% of people are going to be across all of HealthFlex are going to be recommended the H5000. That's just what's going to happen. 67% of people. Another 21% of people are going to be recommended the H2000, and another 8% of people are going to be recommended the C3000. So that is the 3 lowest cost plans. And when you look at the rates, you can understand why, right? Because if you're paying hundreds of dollars more a month, you want to be sure you're getting the benefit of paying those hundreds of dollars more a month. So please use Alex. Alex is going to take into account what the plan costs, what your premium credit is, and then what you tell Alex you're likely to use in services. And then if you are moving to an HSA for the first time, let's say you are in the C2000 today, right? The C2000 today for family coverage is $664. If you're moving to the lowest cost plan, the $40 a month plan, that's a $624 a month savings in premium. Consider putting some of that into your HSA so that when you need to meet that higher deductible, the money's already there waiting for you, and it's tax-free, right? So it's $624 a month plus you're getting a tax benefit on it. And when you build up a balance, you can also invest it. So let's look quickly at a couple deductible examples here. The C2000 and the H2500, which is wrong. So this example is wrong. So on the left, it's correct. The C2000 has, you cover one person, you have a $2,000 deductible, and then the plan pays 80%. On the right, the H2500, you pay $2,500, but then the plan pays 70%. So that 80% is wrong. The important thing here, forget the coinsurance part. The important thing here, because we're talking about deductibles, is how the deductible works. So if one person is covered, the single deductible applies, regardless of the plan. When we look at an HRA plan to an HSA plan, if more than one person is covered, you can see that the deductible doubles, right? You have to pay that full family deductible. And then the coinsurance applies. Let's see if this example is right. So this is the C3000 and the H5000. So in the C3000, one person covered, $3,000 deductible. In the C3000, once you meet the deductible, the plan pays 50%. In the H5000, once you meet $5,000, the plan pays 100%. So if we look at the rates, it's almost a $250 a month difference in the premium between the C3000 and the H5000. So $250 a month times 12 months is what, $4,000? If my $3,000? $3,000. So if you only meet your deductible in the C3000, right? You have $3,000 in expenses and you have $3,000 in premiums to have those $3,000 in expenses, right? You've spent $6,000. In the H5000, to meet $3,000, it will only cost you $3,480. To meet $5,000, it would cost you $5,480, right? So you can see that if you're going to meet your out-of-pocket max in either plan, even though the C3000 is still much cheaper than the 3 gold level and 1 bronze level plan, you're still going to pay less from the C3000 to the C5000 or the H5000 if you are meeting your out-of-pocket max. And then remember, the H5000 is different. The individual deductible always applies because once you meet that, you've hit your out-of-pocket max. We have a couple other things we instituted last year and the year before on HSA plans to help you save as much money as possible on your prescription drugs. First of all, we have the preventive drug list, meaning that on this, I think it's like a 15-page list of prescription drugs for different classifications. If your prescription drug is on that list, you do not need to meet the deductible in the HSA plans. We get to bypass that deductible because they're considered preventive. So a lot of statins, a lot of type 2 diabetes drugs, heart medication, cholesterol medication, plus a number of other medications are on that list. So that means that the copayment and coinsurance apply even if you haven't met the deductible. And we have the current list online. You could actually get there through Benefits Access. And then we've introduced drug rebates at point of sale. Without getting too into the weeds, the way that prescription drugs work is that costs are very high, and then the plan gets rebates at the end of the year based upon how much medication was used. Now, Before drug rebates being able to apply at point of sale happened, what those do is we take those and they just reduce the rates, right? We plug those rebates right back into the plan. What we found is that for the people who really needed the relief the most, the people in the HSA plans who were paying for prescription drugs at the full freight, and then we're looking at the rebates coming back, those people were finding a number of prescription drugs to be unaffordable. So what happens now, and is completely seamless to you, is there's an estimate of the rebate that is automatically applied when you purchase your prescription drug. Now, it's applied across the board, but in the HSA plans, it's more drastic, right? Because you need to meet the deductible before the plan's paying a portion, whereas in the other, we've already got mins and maxes on the coinsurance to keep those costs down. So it's automatically reducing what you pay at the pharmacy. I am about to do a fairly deep dive on prescription drugs over the next 7 slides. Any questions before I get there?
Age 5,000, as you said, once you reach the $5,000 deductible, then it pays 100%, but it only pays for that one individual, correct? Not for your whole family.
For the one individual, and then 10,000 for the whole family. So if I hit my 5,000 next year, my wife hits hers, and we hit our 10, then everything's paid for both of us plus my daughter.
Yeah, but if my wife doesn't meet her 5,000, then it only pays 100% for me and not for her, correct?
Correct. Correct. Yes.
I understand you have to take it in, but I need to go on it. My husband retired. Would this be considered like primary? This would be secondary?
Yes. Yes, the one you take through your employer is always the primary for you. And then if you have both insurances and you have children covered, then whoever's birthday is earliest in the calendar year is the one that's primary for children. Okay. When I get into this pharmacy stuff, prescription drug coverage, please let me know if I'm losing you. It makes sense to me, but I put it together, so it really should. Also for this, we have some videos that were just recorded, some benefit bites that we have online that should be published, I'm hoping by the end of this week, that also walk through this. So if you get a little lost or you need to refer back to it later, we've got the short videos that are gonna hit the high points here. But let me talk through a few things. First and foremost, there's 3 categories of prescription drugs. We have generic drugs, right? They use the same active ingredients as brand name drugs. You take them the same way, but they're a lot less expensive. Preferred drugs are drugs that are usually not available in generic form, but are more cost effective, and that's why they're preferred brand, right? If we have 2 drugs that do the same thing, we prefer the cheaper drug. And then the non-preferred brand, which includes specialty medications, are those where there is no generic available usually, and they're more expensive. All are covered by the plan. Drugs in all 3 of these categories are covered. So let's look at some very specific examples. I'm going to go through generic, preferred brand, and non-preferred brand. I'm going to show you what the cost looks like across the plans if it's not preventive. And then I'll show the example where it is preventive. Spoiler, when it is preventive, it only impacts the cost of the HSA plans, right? Because those are the ones that the preventive drug list applies to. So when we look at, this is a generic drug, these are real generic drugs. I didn't put the names up because I find when you put the names, people tend to Google and see what that drug is used for, or they know it's something they use, or they know they don't, and then they tend to tune in or tune out. So this is a real prescription drug, a real generic drug that is popular on our plan. A 30-day supply costs $110, and a 90-day supply costs $330. So this is not the retail price. This is the negotiated reduced price by having health insurance. If you're in the B1000, C2000, or C3000, we have copays that apply. $10 for a 30-day script, $25 for a 90-day script. So that's what you pay in those plans. If you're in the H2000 or H2500, you pay the 110 or 330 until you meet the deductible. Once you meet the deductible, then you would pay the copays. And you can meet the deductible through medical, pharmacy, and behavioral health combined. So maybe the first time you fill one of these scripts, you've already hit your deductible, you would pay the 10 or 25. And then the H5000, it is 110 and 330 as well. But when you've met the deductible, it's $0 because you've also met your out-of-pocket max. Now I'm looking at the same generic drug, so you'll see the cost of the same here. B1000, C2000, C3000, no change. It's on the preventive drug list, so whether you've met the deductible or not, you pay 10 or 25 in the H2000 or H2500. You also pay 10 or 25 in the H5000. Does that make sense? Okay. I see more nodding than shaking, so I will move on, but stop me if I need to clarify anything. And we have the preventive drug list available online if you're considering an HSA plan and want to see if your drug is on that list. Okay, now we're going to look at a real non-preventive preferred brand drug. It's going to be more expensive. So $267 for a 30-day supply, $726 for a 90-day supply. In the B1000, C2000, and C3000, for a preferred brand drug, we have coinsurance that applies and then a minimum and maximum. So it's 30% coinsurance on this plan that you pay. The plan pays 70%. We calculate 30% of that drug and we say, well, if it's less than the minimum, you pay the minimum, right? So for a $267 drug, you're still saving over $200. We're applying the minimum. And then in another scenario, we would apply the maximum, right? We would, so 30%, but we kind of fix your cost there, right? And then for a 90-day, it's 165. I actually think the 65 and 165 might be the maximums on that. It is the maximum. So the minimum you would pay is $30. The maximum you pay is 65. On the 90-day, the minimum you pay is 75. The maximum is 165. Again, in the HSA plans, it's not preventive. You haven't met your deductible. You pay that full discounted cost. Same on the H5000. Now it's on the preventive drug list. B1000, C2000, C3000 stay the same. All of a sudden, it's on the preventive drug list, so you're paying that same copay. Also in the H5000, same copay. Now let's look at the really expensive stuff, the non-preferred brand. Real drug, discounted cost when you have insurance, just under $1,650 and just under $5,000. Mins and maxes apply. These are the maxes. 30-day, you're paying $120, 90-day, $300. The HSA plans, you are paying that full discounted cost until you reach your deductible. So if you look at a 30-day supply, you're probably hitting your deductible, or I'm sorry, 90-day supply, you're hitting your deductible on that first fill, right? And in the H5000, you're going to pay, let's say, $49.44 on your first fill. You're going to pay $56 on your next fill, and the rest you're not going to pay because you've hit your out-of-pocket max, right? So a lot of people think if I have a really, really expensive drug, I should probably choose this plan, right? I should choose the B1000 because my drug is going to cost me $5,000 every 3 months, which is just about $20,000 a year, right? But if I choose the B1000, I'm only going to pay $1,200 a year, right? But you're going to pay an extra $700+ a month. And if you do the math, you are going to pay less on the H5000. I know it's counterintuitive, but that's why we want to show this example to see, don't necessarily be scared off by this drug that's going to cost you $5,000 every 3 months. Because the other thing you're going to be able to do is you're going to pay your $5,000, you could put in your HSA, you're going to save 20% on it, and now you're really only paying $4,000, right? Because you're going to take that money in your HSA and apply it to what you're buying. Now, it's a preventive drug. It's on the preventive drug list. So just like the examples before, we bypass the deductible and you pay the same. Here's one of my built-in question slides. Was that helpful? Did it make sense? Okay. I see more nodding than shaking. I know it's not perfect. You know, I certainly, if anybody has any feedback after for what they think would make more sense or a better way to explain it, please let us know. Okay, so that's what I'm covering on medical, pharmacy, and behavioral health. Not a lot on behavioral health, right? Because we just kind of talked about how the cost works. I don't have examples for that. Now I'm going to jump into dental. Feel free to stop me if you think of something later that you want to talk about. Yes.
Regarding HSA,
Mhm.
what's the maximum next year?
I have a slide on it, so I hope I don't mess it up now. I believe it is $8,300 for family, $4,150 for an individual, and then an extra $1,000 if you're over age 55. And it's a flat $1,000. So it jumps up to $5,150 or $9,300. And that's reduced by any money that's built into the plan, right? So that's the total amount that can be put in, whether it's the money we have built into the H2000 and H2500, plus personal contributions.
So that's total with what you built in plus.
Yes. So if you take the H2000 and we put 2000 in, you've got to reduce what you can put in by that 2000. Okay. Okay, let's talk about dental. Dental network is a little different on the DHMO. DHMO is a narrow network plan. That is why it's so cheap. I will tell you, I went into that plan, and after a year, I left that plan because I could not find a dentist that I liked. It is perfectly fine to do so. I actually toyed with the idea. I'm really big on trying to find ways to save money on insurance. So I actually did the math and almost, but I thought it was going to be some bad karma. I almost took the dental HMO in case we needed fillings or something, and then just paid out of pocket for cleanings and x-rays. But I decided it wasn't worth the hassle. I might revisit that again in the future. The passive PPO and PPO have a $50 copay, but that doesn't apply to cleanings and x-rays. It's $50 if you have any kind of other service like a filling or an extraction. In-network benefits are greater in the dental PPO. You get a little higher coinsurance that the plan pays on your behalf. They have the same out-of-pocket max, or max benefit, I should say, right? It's different on dental. We've been talking about out-of-pocket max, which is the most you pay. When we get to dental insurance, it's the most the plan will pay. So the plan is only at its richest point going to pay $2,000 per person per year in the passive PPO and the dental PPO. There is no limit on the dental HMO. It's another very attractive thing about that plan. If you can find a dentist you like in the dental HMO, you will most certainly save money. You will, but it is narrow network. And then out-of-network benefits in the passive PPO, it maintains that same level of coverage as in-network. The PPO, the dental PPO, lowers it a bit. And then no out-of-network benefits at all for the dental HMO. If you choose the dental HMO, that's the only dental plan where you'll get an ID card. Each person covered gets their own ID card. It has the dentist's name on the card. You must go to the dentist that's on your card. You can change your dentist throughout the year as many times as you want, but it is always effective the first of the next month. And that's the primary dentist you must choose. If you want to see if your dentist is in network, you can go online and check. We actually have the instructions through Benefits Access. And like the others, I'm not going to go into detail, but if you wanted to see the comparison here, including what some of the dental HMO costs would be, that's on page 8. So all the information I shared, and then a little bit more on the dental HMO costs. One of the big benefits I'll call out for the dental HMO, it is the only plan that has adult orthodontics. There are no adult orthodontics covered in the other plans. So that could be a reason to take the DHMO for a year or two. If you need adult orthodontics, you will save a lot of money. Vision plan options, really, I'm not going to go into a lot of detail here. The big difference is the materials benefit, right? The allowance. In the exam core, it is an exam benefit. You can get a discount on materials, but you're not going to get anything towards the purchase of any contacts or glasses. Full service gives each covered person $160 to use towards glasses or contacts. The Premier gives you $200 per person to use towards glasses and contacts or 2 pair of glasses, but not 2 sets of contacts. I would advise you, if you're going to consider the Premier, look at what you're actually spending on your contacts, what you're actually spending on your glasses. I was, at the time I picked the Premier dental plan, I was getting my glasses at Costco and my contacts at Costco, so I was not using my full allowance. So I was wasting money. And then some progressive lenses built in and some anti-reflective coating copay. Again, these are also going to be found. That's on page 9 of the booklet. Goes into all this detail and a little more. So that was my short section. Any questions on dental and vision? Okay, I'll keep moving. Let's talk. Oh, did you have a question?
Yeah, I want to move back to that. They 5,000 plan.
Okay.
Okay, just take a scenario where I move to that plan,
Mm-hmm.
and now I'm contributing the money that I was going to spend on my C1000. Sounds like Cadillac, but it's really you go and run. Modern Cadillac. So that money that is in the that I've just put into the HSA, I think.
Yes.
Is that full amount available to me immediately if I'm getting that drug that I need? Let's say I'm on Ozempic and I decide, I want to be on Ozempic all of a sudden because I had this epiphany that I need to lose weight and 160 pounds. So am I allowed that money right away for that?
Within HSA, you are only allowed the money that has already been put in. That's an IRS rule. So it would not be only what was deposited at the point you purchased your prescription would be available to you.
Okay, so that's different than the.
It is very different than the FSA, yes.
Okay. So that's a big disadvantage. Number 2, is that money available if I choose to go to the dentist?
Yes.
And there happens to be money there.
Yes. HSA you can use for all covered services. It is your money forever. When you retire, you can take it out and use it for whatever you want and just pay normal taxes on it. So it doesn't have to, at that point, be used for medical or pharmacy or behavioral health or dental or vision. You can use it to pay Medicare premiums if you wish in retirement. Or if you just say, you know what, I saved a bunch of money in there, I'm going to buy a boat. You could pay normal taxes on it and buy a boat if you want. Now, part of the reason that we are hopeful that many people move to HSA plans is because of their savings power, right? And the fact that the last information I saw said that the average person can expect through retirement to have about $300,000 in medical expenses. A lot of money. Up front here. So you can contribute to an HSA until you are Medicare eligible, or until you start taking Social Security. So what you want to do is, if you're going to be taking Social Security in the upcoming year, or if you're going to be turning 65 and taking Medicare Part A and or B, you'll want to look at how much you can contribute in the year. So if you're Medicare eligible July 1st, you can only make half of the contribution, right? Because you're only eligible for 6 out of 12 months. And then for anyone who is, probably no one in the room, anyone who is approaching 65 and will be 65 next year, just know that your Medicare eligibility date is the first of the month that your birthday lands in, unless your birthday's on the 1st, and then it's the first of the prior month. So my birthday is August 7th. So when I turn 65, I'll be eligible August 1st. If your birthday is June 1st, you're eligible May 1st. Question? You cannot. It is right now, it is one plan per person, or one plan per family. Sorry. Yes.
Did you say once you are eligible, Medicare cannot participate?
You cannot contribute to a health savings account. So for many people, that would be a reason to maybe not choose one of the plans, right? I will caveat that and say the H5000 doesn't have a built-in contribution, and it's the lowest premium plan. So there will probably be people who have saved money in their HSA. They're going to have 3 or 4 months till Medicare kicks in, and they say, well, I'm going to stay in the lowest cost plan. I'll save those premiums in my bank, right? I can't put them into the HSA, but I could still save that money, right? Or maybe even for a year, you know, depending on what makes the most sense for you. In the H2000 or H2500, we cannot give you the contribution that's built into the plan. So that plan automatically becomes less attractive for you, right? Because there's a component of the plan that you can't have. You can't have that free money.
No such thing as free money.
True. But you can't have the money that you're paying for, right? It's built into the premium. That's a better explanation. Okay. Premium credits. So I'm going to talk about this very briefly. I was happy to see, I took a quick look. I think all my numbers match what's on your handout. You don't have to check it and make me feel bad if they're not. But right now in the conference, the default plan is the C2000. That only applies to someone who's brand new to HealthFlex. If you're in a plan today, we don't just move you out to the default plan every year. But the importance of the default plan is because for most conferences, and I think yours is no exception, conference chooses the default plan and the premium credit kind of hand in hand. C2000 is probably one of the more common default plans, and the vast majority of conferences kind of set their premium credit based upon what percentage of the C2000 they're looking to cover. So net cost, these look like they matched when I took a quick look, but you have the sheet in front of you, so I don't need to spend a lot of time here. Dental premiums, default for people who are new to the plan is no coverage. You can see just quickly how inexpensive the DHMO is, the other plans. Family coverage in the DHMO is barely more per month for the passive PPO for participant only coverage, right? So it's, even though the network is narrow, even though there are people who cannot take advantage of the DHMO because the network is narrow, we still do have probably about a third of the people in the DHMO, and because it's so inexpensive, we feel like it's still the right thing to do is offer that plan.
Where would you look to find it?
So
Find a list of providers that are.
so it's when you log into Benefits Access, we've got a list there in the dental section, a link to how to look them up on the Cigna website. That's probably the easiest way to do it. Yes. Yeah. Yeah, and I mean, I'm in a suburb of Chicago, right? Pretty big metropolitan area, and I was not able to find a dentist that I wanted to go to, right? And sometimes they've been a little nebulous on the rules for how they set that network. I believe that, I haven't been able to prove it, I believe that if you have one dentist in the network within 35 miles, you'll be presented with that you have a dentist in your area. So if you don't like that one dentist, you know, I know that we've heard a lot of people have complaints about Aspen Dental, who was in the network. Their business model is very much to get you to buy up. That is who we went to in the first place, because I knew nothing about them. And they told us we needed a $100 tube of toothpaste. And it was at that point that I said, we're not coming back here. We just didn't go back to them. They are not in the DHMO anymore, which I was actually happy to hear. Yes.
I get the elections every year. I can look. Send you an email, say.
Yeah. And we also send emails to say, don't forget to pick your dentist. You know, if you are in a situation where you choose the DHMO because you like the dentist, we actually found one we liked, and then he immediately left the network. So we chose the dental PPO because he was in that one. You know, if mid-year you don't have a dental option in the DHMO anymore, like you had when they leave the network, reach out to us and we can, I mean, there's an exception process, but we're not going to make you not have dental coverage when through no fault of your own, the dentist left the network. As you can see, Premier Vision jumps up pretty significantly. So make sure if you want to choose that plan that you're going to get the full benefit of that plan. Now I've got a couple examples on paying for HealthFlex that I just want to walk through. So here's the C2000 example of premium or premium credit, premium dental, and just how it works. So your premium credit is $838, right? Did I mess? Okay. Premium credit is $838. Single coverage in the C2000 is $1,120. You choose a dental plan, that's $34. You choose free exam core coverage, no cost exam core coverage, and contribute to the HSA. So your total premium is $1,120 plus 34 plus 0, which is $1,154. The portion that exceeds the HSA or exceeds the premium credit is $316. And then you're contributing $100 to your FSA. So that means your total cost per month here would be $416. We look at an example with 2 people covered. Premium credit is $1,599. Premiums in this example, we've just got the H5000, so not taking dental, not taking a buy-up vision coverage, but then contributing $300 to the HSA. So in this case, $73 is the difference you pay per month to have coverage, plus the $300 you're contributing to the HSA, and there's your $373 a month. Okay. I'm going to talk in more high level about the health accounts, because I know we've touched on some of that already, but please let me know if you want me to go into more detail. The big thing, 4 out of 6 plans have money built into them, right? It is built into the premium. It's part of the cost of the premium. So the H2000, H2500 are the 2 HSA plans that have money built in. That money is available day one, right? So this is not contributed monthly. This is as soon as you are effective in the plan. Sometimes it takes a few days for it to post, but it can be used for services incurred from the time you're in the plan. Same with the HRA plans, they have money built in. You'll note that the most expensive plan, the B1000, does not have money. The least expensive plan each month, the H5000, doesn't have money built in. But it is because of that that we can keep that plan as low cost as it is. If we put money into the B1000, it would be even more expensive, right? Because the money has to come from somewhere. And then in the HSA plans, you can put money into an HSA or an FSA. Of course, you don't want to put money in an FSA unless you've already maximized your HSA. And then in the HRA plans in the B1000, the only way you could put your own money in is by contributing to an FSA. We already talked through a lot of the benefits of the health savings account, so I don't want to talk about it, in any more detail. This is really just a reminder of how that money works, and that over 90% of people would pay the lowest total amount in one of the HSA plans. Here's the limits. I think I mentioned earlier the self-only and family coverage for the HSA for 2024, $4,150, and then doubled to $8,300 with an additional $1,000 if you're age 55 or over. The FSA limits for 2024 have not yet been reduced or been announced. The IRS tends to do that right in the middle of AE so that it makes it more difficult for us. Yes.
For the HSA over 55, is that just one person has to be over 55 to get the extra?
The primary participant has to be over 55, yes. HSA and HRA keep rolling over year to year. Don't have to worry about losing any money. For the FSA, as of last year, it was $610. I've seen estimates anywhere from $620 to $670 that are going to be able to be carried over in 2024, but we don't know yet. And then I mentioned portability. HSA is yours forever. HRA, if you terminate or waive HealthFlex, you get 90 days to spend it down. If you retire, you can take it with you into retirement. If you terminate or waive HealthFlex, your FSA stops immediately. You can only get reimbursed for claims prior to your termination date. And then the HSA is the one that you can invest. And the only other thing I'd want to mention on this is HRA. If you have an HRA and you are not in a plan where you're likely to get another contribution, so you're not in a C2000 or C3000, or you're retired, or you're within your 90 days, we will notify you when the balance is less than $100 and ask you to spend it down, because we don't want to keep paying fees each month for low balances. But for example, if you're in the C2000 today, right, it's October 16th or so 17th, you're in the C2000 today, you spend all your HRA money except for $50, we're not going to ask you to spend that down because you might choose that same plan again for next year. So a couple quick considerations of which plan, which account you might want. I mentioned maybe you don't want to be in an HSA plan if you're approaching Medicare. You might want that HRA money because you want to get the full benefit of what you're paying for. The other thing is if you have high prescription costs, but otherwise no medical costs, you might benefit from getting that first dollar coverage in an HRA if you don't have preventive drugs, right? Because you might actually, especially in the C3000, if you only have prescription drug costs that are going to save you hundreds of dollars a month, and that's the second least expensive plan, that might be the right plan for you, right? But for many people, if you're able to put money aside in the HSA, that is always going to be the one that's going to save you the most money. We have a couple handouts. I say handouts. We have a couple. I don't have them with me. We have a couple PDFs online that you can look at. Considerations if you're approaching Medicare eligibility, and then something we want you to read if you're thinking about doing an FSA and an HSA. Again, we have all of this health account information in this booklet on page 11 and 12. So the kind of back 2 pages go over everything that I covered. With all the changes that we have in HealthFlex with care coordination and changing our HSA plans, Health Equity decided about 6 weeks ago that they were going to drop on us that they're making some updates to their cards. Now, we can't be too mad because they're moving in the direction we want them to. Right now, there's 2 different cards, right? We have the purple and white HSA card and the teal and white FSA/HRA card. By the middle of next year, they're going to move where it's all one card. So everyone gets one card. The card knows what account you have. It knows how it has to pay. They are first transitioning all the teal and white cards, which makes it more confusing because at some point we'll have 2 different purple cards. But what I will tell you is that if your card is not expired yet, or you don't lose your card, Just use the card until you get this new chip card. And then when you get this chip card, use that card, right? So that means that for some people, if you're getting a card for the first time, or if your teal card isn't expiring, or I'm sorry, if you're getting a card for the first time, or if your teal card is expiring, you're going to get one of these solid purple cards. By the middle of next year, everyone is going to have just the one card, and we hope it stays that way forever. So if you have questions when you get a card in the mail, call Health Equity, but I would say if this card comes in the mail, activate it and use it. Does anybody care about dependent care account, flexible spending accounts? So this is for like daycare for children, or certain disabled adult care. Nothing's changed on this in like a decade or more. It's still the same super low limit that you could put aside $5,000. That is like 2 weeks of summer camp or 2 weeks of day camp. Just know that you don't use a debit card for this, and know that when you're asked, it is not for medical care for your dependent. It is for daycare or elder care. Getting towards the end, so and we'll have time again for questions, but you'll at least get a break from hearing me unless you want to hear more. Decision support. The two things we really want people to utilize are Alex and the How Do I Choose brochure. How Do I Choose is online. It's basically a slimmed down version of this though. So since you have this, feel free to use this. You don't need to go and look at less information, right, when you have this handy. But please use Alex. Alex is available now. Does a really good job of explaining confusing concepts. About 30 minutes to complete. And when you look at how much healthcare costs, it's really not a lot of time to spend on healthcare each year. I know that I've had conversations with my wife where she's talked for much more than 30 minutes on which boots she needs, right? And they better not cost anywhere close to what health insurance costs. You'll get that personalized recommendation of this is the plan you want. And like I said, 67% of people are going to see the H5000. And we've kind of gone through why. Alex is going to show you, I'll show you on the next couple slides, Alex is going to show you kind of where your costs are. Definitely has lively graphics, definitely has animation. I say it has like dad joke humor. So it is not a comedy show, right? You might chuckle once or twice. Make sure you're selecting who you are, right? For the vast majority of people, it's going to be clergy still working, lay employee of the conference office, lay employee at a local church, right? That's the vast majority of people. Maybe a pre-65 retiree. If you're a pre-65 retiree, you would choose the retired clergy or retired lay. So it's going to lay out, again, show you the portion that's your premiums. Look at the biggest line on all these is the premiums, right? No matter what plan it is. And then it's going to show your estimated cost based on what you put in, what you said you're going to use next year. It's going to use national averages to figure out what that is. And then worst case scenario is going to be your premiums plus your out-of-pocket max. That's what that number is going to be. Alex is going to explain tax savings, right? It's going to say, hey, you're going to have this much as expenses. You could save money by putting it into an FSA or an HSA. Do you want to do that? OptumRx drug pricing tool. This is available online. You can go through the AE site or Benefits Access. That's the easiest way to get here. And you can look at those prescription drugs and find out what the cost of them is, right? Helps you choose between plans. Remember that a lot of what you're paying for in health insurance for your premiums, it gives you things even before you meet the deductible, right? You get your well person checkup. We've got those $0 virtual visits through MD Live. Even if you're paying that full discounted cost for medication, it is still greatly discounted over what it would cost if you tried to purchase it at the pharmacy without having health insurance. We're applying those RX rebates at point of sale, and those, if you have a preventive drug in the HSA plan, it will bypass deductible. We will have this year HealthFlex fully integrated into Benefits Access. So last year we sent you to a public site for information. That's still going to be there. But if you go through Benefits Access, you're going to get personalized information and targeted messaging, right? So you're going to get, if you're in an HSA plan, you're going to see something talking about the HSA changes, right? If you go out there, you'll get your personalized Alex link, right? So all of those things are there. Benefits Access is the best place to go, but it's not the only place to go. You can still go to the public site, and anything that's not personalized will be there. We've got some upcoming webinars. I already mentioned the HSA webinars. Invites went out for those. We're going to have an annual election webinar invite going out soon that anyone can join. I will tell you, if you join that, you're going to hear probably what I've said here today, but less, right? Not in the detail I've gone into today, but you probably, unless you have specific questions you want to ask, do not need to worry about going to that AE webinar. RX Q&A opportunity. So this is something new. We found that making ourselves available for questions during annual election is pretty well received. I went through those pharmacy examples today, right? The different cost examples. We have benefit bite videos that we've put together that are going to be on our website, hopefully by the end of this week. I mentioned that earlier. You can go and take a look at those. We are going to be sending links to those out to everyone in HealthFlex, and then having, along with a reminder of this webinar, so if you have pharmacy questions, you can just call in. It's the first day of AE, call in, 2 o'clock your time, and myself or somebody else will be there just ready to answer questions. And if we run out of time, we'll find a way to schedule another one as well. You can also just reply to that email invite if you have a specific question that you might not want to ask in front of a big group of people. And then we're going to have a general AE Q&A as well. We'll probably do a very quick 5 minutes at the top, and then just be available for questions. So you're going to make your elections through Benefits Access just like last year. The premium credit's automatically going to be applied. When you go through, it's going to ask if you want your premium credit. Say yes. If you say no, you're not going to see that money applied when you walk through, and you're going to get some sticker shock, right? Because you see the difference here. But we will make sure that we go through and apply it if you miss it. If you miss it, you're going to see some big numbers when you finalize your elections, but we'll make sure that it gets applied. Annual election is going to be November 1st through the 16th. If you're in the B1000, C2000, or C3000 today, you will stay in that plan for next year if you don't make elections. Any dental elections and vision elections you have will carry forward next year, even if you don't go online. But if you're in one of the HSA plans, remember, we're automatically going to move you gold to gold, silver to silver, bronze to bronze, because we don't want you to be without insurance if for some reason you didn't get a chance to go and make your elections. Yes.
On page 10, dealing with the vision benefits, as I look down the lines for full service and premier, everything looks exactly the same. So could you explain to me again the difference between the two? Because everything listed there.
So if you look at the big ones, or look at the third line down, the frame details. So the allowance on the frame details, oh, I'm on page, sorry, I'm on the wrong page. So these are on the exams. Or this is out of network. Out of network is the same on page 10.
Oh, okay.
So these are, you're right. All of the things on page 10 are the same. Page 9 has the differences.
Okay, so page 10 is out of network and page 9 is not.
Correct.
Thank you.
And then laser vision correction, which is the same benefit. So the top part is out of network. The extra savings are just some extra things built in the plan. And then the laser vision correction is the same no matter what plan you choose. It's just a discount.
Thank you.
Yeah. Yes.
Can you talk a little bit about that entry buy? What is that?
Sure. Sure. MD Live is our partner for telemedicine. Now, when COVID happened, a lot of other primary care doctors started doing like telemedicine visits, right? And that's going to be whatever rate that they have negotiated for. It's going to be the same that you would pay if you went in the office, right? MD Live allows you for certain and only certain diagnoses to be seen by a doctor virtually, right? So I have the app on my phone. You know, I have just recently with my allergies, sometimes I get like some irritation in this specific eye where my eyelid blows up. It's happened like 5 times in the last 20 years, but it happened earlier this year. And so what I was able to do is I pull out my phone, I say that I want to talk to someone at MD Live, I take a picture of my eye and send it to them. They say, this is what it is, this is what you need, and I go pick up my prescription. So it's really good for, you know, certain like skin abrasions and things they can do, definitely things with the eye or with a rash, like a lot of times they can do that. What I really like about it is I don't have to go to urgent care or the ER where I'm going to sit there with a bunch of other sick people, right, and get something else. You know, the one time I had, I actually got pink eye from the gym, and I talked to the doctor while I was walking my dog around the block, right? So I didn't have to do anything except talk to them on the phone and go pick up my prescription. And I thought it was great when it was $40 a visit. Now that it's free, it's even better, right? Or now that it's zero cost. So what I would suggest is if you haven't signed up for MD Live, activate your account and do it so that you don't have to do that step when you need to use it, right? But it's really good for what it's, I mean, it's a smaller scope of care, right? You can't do everything over the phone and through the app, but for the things you can, it is super convenient. And they're available 24 hours a day. Mm-hmm. Mm-hmm. Yep. And we now have behavioral health visits through MD Live as well for free. So if you need to talk to somebody, you want to talk to somebody, it's a great like low pressure way to see if that's something that's going to work for you. And we've also found, especially for clergy, you know, small towns, right? Lots of churches are in small towns. You know, unfortunately, there's still a stigma around getting care. You know, maybe the only provider local is somebody who is sitting in the pews on Sunday, right? You don't want to go to that person. Now you have the opportunity to go through your app and find somebody to talk to. Yes.
So there are psychiatrists.
I have to look.
Yeah.
Is it psychiatrist?
Yeah, I can't tell.
Well, like, so my daughter sees a psychiatrist for medication management.
Okay.
But I mean, this was saving a lot of money because she has to go, they only give her 3 months at a time, and she's mainly been doing it by virtual.
Mm-hmm.
That would save us a lot of money, but then she would be giving up relationships she has.
That's the tricky part, right? That's the tricky part. And I don't know, what I don't know there is if you get the same person all the time or not. I do not know that. You do, right? With the psychiatrist, you can get the same person. That's okay. I appreciate the expertise. Hold on one second, in the back.
Can you get an additional HSA card for an adult dependent?
Yes.
Geographically not close to each other, right now with one card.
Yes, you can. Just call Health Equity on the back of the card. Yes, sir.
Okay, now, let's say a hypothetical clergy person is hired. What do you do to move into the insurance after retirement?
Is it retirement under 65 or retirement over 60? Under 65, you're going to stay, you'll automatically stay in the same plan.
It's automatic, I don't have to do it. Oh,
Correct.
sorry. I don't have to do a thing.
One does not have to do anything.
that one person.
Yes. Yes.
If you are under 65 and you wish to stay on our plan, retired status, you, I can send you a bill every month.
Yes. I'm gonna move so I can see you.
Sure. I'll take the blame.
Go ahead.
So our health insurance one is on fallen.
Yes, you can choose not to cover the conference plan. However, under 65, we are active. Retired.
And wait, Becky, say your question one more time. But you will not be. You're retired, right? So that's, so your church is also not paying that. That's. So, right, but that's the other thing. I know a lot of folks are retired, but it's still everyone has that.
We're going to have I'm just going to go through, I got a couple slides real quick, and then we can take as many questions as you guys want to ask. Beginning November 1st, the AE support line will be live. If you have some basic questions or if you need them to make the elections online for you, right? Retirees can't go on and change their plan themselves. You can call this number and they'll do it for you. That's just a system access thing, right? If you want to change your plan, we have not, the user experience is not where we want it to be for people to use it. So for retirees, we still have that you need to call in and make those elections. So avoid mistakes. Please use Alex. Please know that Alex is not making your elections. It's just giving you a recommendation based upon what you've input. Make sure you're writing the right HSA or FSA contribution on your charge conference form. If you choose the DHMO, make sure that a dentist you want to see is in network. When you walk through and you want to make contributions to the HSA for the first time, you have to accept the terms and conditions. If you've already accepted those, you do not need to do that every single year. And then don't elect a dependent care FSA if your kids are over age 13 and you think it's going to be for medical coverage. I mean, I don't know that I think people will love Alex. I think people will find Alex very useful, right? And it at least gets you thinking about that total cost. You know, I know it's a lot of choices, but it is by design. You know, we have a very unique group in the UMC, right? And people have unique needs, and that's why we have the plans that we offer. You know, you've got choices for dental and vision. Maybe dental aren't the choices that we all necessarily want for the DHMO, but there are options there. And then, you know, please take advantage of using, you know, the tax savings afforded by the FSA and especially the HSA. And that is my last slide. Yes. Sure. Mhm.
That's the middle one on the left, writing the person on the board.
Mhm.
I'm thinking that there's a form, but I don't know that it's. There is a form. It just isn't part of what.
Okay.
It's not part of our compensation package.
Gotcha. Yep. Yes.
For the next 2 weeks.
If you log into Benefits Access and you're in HealthFlex today, you will see the Alex link. You'll also see a kind of like an AE is coming link where you could learn more, and that's going to take you to all that information that we have on the public site, plus some of that more targeted information. And then that one is going to change to AE is here on November 1st.
So people could go use Alex now.
Yes.
Figure out what plan they want. Then
Yes.
How old are
I mean, it's 26. Yes, it's 26. Since you asked, I'm gonna let you all know of a very strange rule with HSAs if you have an adult dependent child on the plan. So I'll use my household as an example. My daughter's 11, but my wife and I are covered. If our daughter was 26 and covered, or even 21 on our plan and filing her own taxes, she could open her own HSA and make her own contributions that don't count towards the limit because she's covered under IRS qualified high deductible health plan. So covered on the plan as an adult, even though, so if your child is filing their own taxes, they can still be covered on your plan. And if they're filing their own taxes and therefore not able to be reimbursed from your HSA, because the HSA is for tax dependents, they could open their own HSA. So as a family, you could then put away, for 3 people, over $12,000 a year. They could open it wherever they want. It wouldn't so they could contact Health Equity directly to do it. We can't do it, on their behalf, but they could go to their local bank. They could call Health Equity on their own. Any other questions? Okay, well, I definitely appreciate your attention and all the questions. I'm not going anywhere if you come up with something else. I know it's a lot, so feel free if you have other questions, ask me now, reply to those webinar invites. If you have specific questions, call the active benefits team at Wespath, which is the 1-800 number, and be on the lookout end of this year and beginning of next year for more information on care coordinators. Thanks.
So thank you to Bob for coming out, for giving us 2 days here. Again, if you have any follow-up questions, feel free to shoot me an email or give me a phone call. I know I'm going to get calls on the 15th. Please, I would love you to start at the 10th. The 10th would be great. So travel safe. Thank you for coming out today. We'll talk to you soon.